Apart from oral nutritional supplements or milk, medications are also delivered through the nasogastric tube into the stomach. Some medications need to be separated from the milk feeding, as taking them together may reduce their effectiveness. These are some examples of the medications. To ensure the best effect of the medications, it is important to strictly follow the pharmacist's advice on the timing of administration. When preparing medications for nasogastric tube feeding, it is important to pay close attention to make sure you mix and give the medications correctly. This is done to prevent the tube from getting blocked. Your care recipient's medications may come in various forms: liquid, enteric-coated tablet, uncoated tablet, hard gelatin capsule, or soft gelatin capsule. We will now learn how to prepare the different types of medications for nasogastric tube feeding. Wash your hands with soap and dry them thoroughly. How to prepare liquid medications. Gently shake the bottle of the liquid medication to ensure proper mixing of its contents. Carefully pour the prescribed amount of liquid medication into a medication cup. How to prepare tablet medications. Begin by placing the prescribed medications into a mortar. Use the pestle to grind the medications until it becomes a fine powder with no visible clumps. Pour a small amount of water into the mortar and continue to stir until the medications dissolve completely in the water. Pour the ready mixture into a small cup. How to prepare hard gelatin capsules. Begin by separating the two halves of the capsule and empty the powdered contents into a cup. Add a small amount of water to the powdered medication. Stir the mixture until the powder has completely dissolved. How to prepare soft gelatin capsules. Cut a small opening in the capsule. Fully empty the medication content in a medication cup. Pour a small amount of water in the cup. Stir the mixture. It is important to note that Nexium, like some other medications, may have a protective coating and is not meant to be crushed. Pay careful attention during the preparation process to prevent any blockage in the tube. How to prepare Nexium. Pour 30 ml of water into a medication cup. Place the Nexium in the cup. Allow Nexium to slowly dissolve. We will now learn how to administer medications through the nasogastric tube. Wash your hands with soap and dry them thoroughly. Check the position of the tube, following the nasogastric tube feeding procedure guidelines. Ensure your care recipient is tolerating the feed well and that the tube is correctly in place before proceeding to administer the medications. How to administer tablet and capsule medications which have been dissolved in water. Before administering, swirl the medication mixture to ensure any residue that has settled at the bottom is fully dissolved. Pull the plunger and draw the dissolved medications into the syringe. Withdraw additional 5 ml of air. To administer the medications, clean the pot. Connect the syringe to the nasogastric tube with the tip facing upwards. This is to prevent the medication residue from clogging at the tip of the syringe. Invert the syringe and slowly inject 10 ml of the medication mixture into the tube at a time. Repeat this process until the syringe is empty. Once the syringe is empty, bend the tube. Disconnect the syringe from the tube, and recap the feeding pot. For water flushes after medication administration, fill the syringe with 30 ml of water and 5 ml of air. Connect the syringe to the nasogastric tube. Invert the syringe and slowly inject 10 ml of water into the tube. Repeat this process until the syringe is empty. Once the syringe is empty, bend the tube. Disconnect the syringe from the tube, and recap the feeding pot. How to administer liquid medications. Attach the barrel of a syringe to the nasogastric tube. Slowly pour the liquid medications into the syringe. Release the tube band and allow the medications to flow slowly. Flush the tube well with 30 ml of water to prevent tube blockage. When it is completed, bend the feeding tube. Disconnect the syringe from the tube, and recap the feeding pot. Remember to keep your care recipient in an upright position for at least half an hour after feeding, to prevent regurgitation. Thank you for watching this video.